Hi, thank you for listening to me tonight. My name is Terry Ann Shell, and I'm a board certified lactation consultant, and I'd like to talk to you about a rationale for the development of a mother's milk bank in Alaska. We all know that breastfeeding is the normal way. It's also the healthiest way for all babies to eat. In the United States, about 75% of newborns start out breastfeeding, at least get some breast milk, and in Alaska that number is 87%. Almost all of our babies start out breastfeeding. Unfortunately, some of our babies are born sick or premature and are admitted to a neonatal intensive care unit, a NICU, but they still need the breast milk, and sometimes their mothers are not able to supply it. We all know that use of donor milk or any of mother's milk helps to shorten the hospital stay, and that saves lots of money. There are many initiatives to support the use of exclusive breast milk in babies, all babies. The Center for Disease Control, the CDC, would like to see us reduce the proportion of breastfed newborns who receive formula supplement within the first 2 days of life. Right now it's 24.2%. They'd like to see that number go down to 14.2%. In the past few years, the Center for Disease Control has surveyed every hospital in the country about their maternity practices in infant nutrition and care, INPINC scores. They gave each hospital a score as to how well they're doing, and they published the scores for the national and also for each individual state. They would like to see the hospital staff continue with breastfeeding and only disrupt it for rare medical complications. The Joint Commission is who certifies many hospitals throughout the United States. They would like to see exclusive breast milk feeding, and as they come and do their inspections, they have many questions that they ask about the exclusivity of the breast milk and what practices nurses and doctors do if they supplement at any time and for which reasons. There's also an exclusive breastfeeding goal in the Healthy People 2020 goals. Their goal is to reduce the proportion of breastfed newborns who receive formula supplement within the first 2 days of life. Right now, we want to increase the rate of ever breastfed to 81.9% across the country, and currently it's 25% of newborns are supplemented before day 2, so we're pretty far away from reaching that goal. The American Academy of Pediatrics reaffirms its recommendations. They recommend that babies be breastfed for the first 6 months of life exclusively, continued on to 12 months and longer for as long as mom and baby are both happy with it and families are doing well with it. 6 months to whatever with supplemental foods. To help meet all those goals and to have healthier Alaskan babies that grow into healthier adults, we need to boost our exclusive breast milk feeding rates, even in the NICU, and to make donor milk available at reasonable prices to Alaska sick babies. For those reasons, I suggest that the Blood Bank of Alaska should open a mother's milk bank. The blood bank is planning a new building off of Airport Heights Road, and it has room in there for many new programs. This can be one that will boost their popularity in the community. They already have lab there to do blood testing. With milk donation, there's testing of mothers, so this would go right along with that. The only thing that they would need is a pasteurization machine to help pasteurize the milk. But everything else is already in place. They're already doing everything. They're already shipping milk and bringing back containers, or they're shipping blood and bringing back containers. They can do the same with the milk at the same time and using the same process. So it makes sense for the Blood Bank of Alaska to open the Mother's Milk Bank. The blood bank is already known to the community, but it would offer sick babies a valuable asset that will be popular, even more popular with the community. Additional funding for all the blood bank programs can be realized from the additional program of the Mother's Milk Bank, and this program really falls under the blood bank's purpose and mission of serving the Alaska community and making healthier Alaskans. This program will draw success from the sharing of resources, the abundance of Alaska mothers who are already breastfeeding and have extra milk and looking for a place to donate it, and the partnership the blood bank already has with all of the Alaska hospitals. Right now, only our high-risk NICUs are getting milk from milk banks. They're in the lower 48, and it's pretty expensive to ship it up here, and it's not always available. They're not taking advantage of the mothers that are already here and willing to donate milk. So an Alaska milk bank will provide a place for mothers in Alaska to donate that extra milk, and that will go to help save babies. It will also lower the cost of donors' milk to the NICUs that are using it and to the other hospitals by saving and shipping, and it may be even less expensive to have the blood bank, since they already have a lab, do a lot of that lab work for it. More milk will be available to babies who need to be supplemented, and maybe we can supplement with mother's milk at those times when right now we're supplementing with formula that will keep our exclusive breastfeeding rate. Here are some of my resources, and I hope you will consider opening a mother's milk bank in Alaska and supporting this important project. Thank you, and have a nice evening.